So without any further delay, let's dive onto the virtual sea of knowledge and exploration. And thank you for joining us for the today's webinar. Today we are going to discuss about the topic Global Clinical Exposure, TAU's MD program and clinical rotations in the USA. I'm glad to introduce the speaker of the day, Dr. Hugh K Duckworth. Over to you, sir.
Thank you very much, and good evening to everyone. I am Dr. Hugh Duckworth, the provost for Texila American University and Texila American University College of Medicine. Prior to, and by the way, I've been with Texila American University since 2018. Prior to that, I was the provost at St. James College of Medicine in Anguilla and Nevis for 3 years. Before that, I was the executive dean at Sabin University. I was there for a number of years. I started as clinical medicine professor and was with Sabin University for over 10 years. Before that, I spent about 10 years or so as a practicing general surgeon and 4 years as an emergency room physician. As I said, Texila American University College of Medicine is a part of Texila American University, and the College of Medicine is a part of that university, and I am the provost. Texila American University began in 2010 in Georgetown, Guyana, and since that time, the university has thrived both academically and from an infrastructure standpoint, and they have done so much so that we have recently been able to achieve a significant milestone, and that is accreditation. We've been accredited within the last year and a half or so by two separate entities. That is, one is the ACCM and the other CAMHP. These are both accrediting bodies which accredit medical schools primarily in the Caribbean, and CAMHP also accredits not only medical schools but other colleges, but primarily medical schools. Why is accreditation important? Both of these entities, CAMHP and ACCM, are recognized as legitimate accrediting bodies by the World Federation of Medical Education. The WFME is the global organization that oversees accreditation for all medical schools on the planet. They have recognized both of these entities, ACCM and CAMHP, as legitimate medical school accrediting body, the LCME, or in India or in other countries. So this has been a major milestone for Texila American University, and this accreditation means that we are on the same level academically with any other medical school really in the world. It also opens up other avenues for research and other funding for students and scholarships and loans. All kinds of opportunities open up because of accreditation. So accreditation has been a major milestone for us, and we're very happy and proud that we've been able to achieve this fairly recently. This also opens the door for our graduates. Once our students graduate from medical school at Texila, their licensing becomes possible virtually around the world, as long as they, follow the individual countries' rules and requirements. The first step, though, is to be graduated from an accredited medical school, and what we've been able to. So students at Texila American University College of Medicine are enrolled twice a year, once in March and once in September. The requirements to be accepted to medical school are pretty much the same classic requirements for entry into medical school around the world. That is the basic sciences, such as inorganic chemistry, organic chemistry, biology, English, physics, and so forth. Also, students who have advanced standing are considered strongly. In other words, students who may have gotten further along in their college Also, Texila American University has a pre-med program, which I won't talk a lot about today. There's a lot of information on the website about it. Um, but it consists of 3 semesters. And once a student has completed it, they have completed all of the prerequisite requirements for medical school, classic prerequisites. Um, and we also include some courses such as Spanish medical technology, which is becoming more and more important across the. But once students finish the pre-med course, uh, they are eligible to sit for the and to apply for medical school at Texila American University. And that starts with them sitting for the TMAT. The TMAT is the Texila Admission Medical Test, or excuse me, admission test. It's an MCQ exam. It's a 200 questions. The questions have been created by our faculty through the years here at Texila, and the score should be 70%. Students are required to pass this exam in order to be eligible to apply to medical school. And as I said, it's been vetted over the last number of years, and it's proven to be quite helpful. Once a student passes this exam, then they will move on to the MMI, the multiple mini interview. These interviews are conducted by a number of faculty members, existing faculty members, virtually, of course. And the students are evaluated psychologically, and they're evaluated for a number of criteria, as you can see here, including the decision-making process, critical thinking, reasoning, and these types of things. These are all issues that are very difficult to gauge, but the fact that we do it in so many different steps, it seems to be quite a. Once the students are admitted to Texila American University, and they come to Georgetown in Guyana, where our basic science campus is located. We have an extensive orientation program for the students, and it starts immediately. We have hostel accommodations for everyone for the first 6 months. All students are given advisors as soon as they arrive, and these advisors are not only faculty advisors, but they are also student mentors, older students who have been there, senior students who have been there on the basic science campus for at least a semester or so, and are able to help guide them and show them the ropes, so to speak, and help them adjust a little bit easier. As I said, the academic counseling and career counseling also begins almost immediately. This usually starts with the faculty advisor. And as we'll talk about in a moment, as we talk a little bit more about the curriculum, it occurs pretty much throughout their medical school stay. Also, students, like I said, we have a hostel. We also have our very final stages of beginning to break ground on building even more hostel space and accommodations for all students and faculty right there, very close to, literally right on their campus. So we're very happy about this. We try to make the process of relocating to somewhere such as Georgetown, Guyana, as smooth as possible for students. And we also have a cultural meet and greet when they first arrive so that they can meet their fellow students. Students come from all around, and we have a tremendously diverse student body as well as faculty, and students are able to help each other adjust and become ready to face the rigors of medical school. So once they begin day one in medical school, begin the process of a very classic medical school curriculum with a few differences. And as you can see here, their first semester students are exposed to anatomy, embryology, histology, biochemistry, all the classics. Also, though, research methodology. This is a relatively new introduction in the basic sciences, and quite helpful for students to learn the details of the process of doing research and to critically evaluate research as it is published. Also, we began the process of the doctor-patient relationship, and it's very early on hands-on clinical type experiences for the students. Very basic at first, such as history taking and things like that, but it does expose the students. We'll say that at the end of each semester, all of our major courses, the final examination, which is the National Board of Medical Examiners examination. It's an online exam. For example, we give the exam in physiology here, as you see in MD2. Physiology final exam would consist of the National Board of Medical Exam in physiology. Final exam in anatomy and embryology, for example, would be the National Board of Medical Examiners final exam in anatomy and embryology. These are internationally recognized, standardized exams. We don't use in-house final exams for our major courses. This allows us to assess how we are doing in regards compared to other medical schools, because all of this data is reported by the NBME. And also, it allows us our faculty to keep up with the latest and to be sure that we are teaching our students exactly what they need to learn in up-to-date material. So it's an external benchmark, which allows us to evaluate how we're doing and how our students are doing compared to other major medical schools. These exams are used in every single one of our major courses, including our clinical rotations, as you'll see. But here in the second semester, the students can go on with a major medical curriculum, neurosciences, behavioral sciences, ethics, so forth. Also, as you see, it continues on with the doctor-patient relationship and research in psychology. Continues on into the third semester. Here, the students begin very important courses in pathology and pharmacology, and as well as microbiology. Again, the NBME are the final exams for all of these courses, and it's a very valuable tool for us to allow our students to evaluate their strengths and weaknesses, as well as our faculty. By the time students are MD4, they're very used to taking these NBME exams. As you can see here, they continue on with pharmacology and pathology too, very big, important courses with much important material for their basic science knowledge. Also, they continue on with the basic science relationship, the doctor-patient relationship, as well as the beginning of basic psychiatry. Basic psychiatry is so important in the practice of medicine, and everyone who practices medicine on a daily basis somewhat of a psychiatrist. So it's important that our students begin. Again, in pharmacology here and pathology, the final exam is the National Board of Medical Examiners. Once they finish MD4, now they have pretty much completed basic sciences. And their final semester is spent, and this is a very important semester for our students as they move on into clinical training. The transition semester has what is called a course called the Integrated Basic Science Review. And what this is an intensive review of the entire basic science curriculum that began from day one with anatomy. And what this is the online video Kaplan Review course. This is the Kaplan Review course, which is out of the United States. It's a company that prepares students for USMLE and other types of licensing exams. And it's a tried and tested review course, which is important for our students to identify their weaknesses and their strengths as they prepare to take the comprehensive final exam. This is another National Board of Medical Examiners examination, and it is an exam that covers the entire basic science curriculum. And it's a very important exam because it's very predictive of how well the students are going to do on their future licensing. Also, let me just add, I neglected to mention earlier, our campus in Georgetown, in Guyana, at Texila, is approved by the National Board of Medical Examiners as a secure testing site, an online testing site. So with the National Board of Medical Examiners actually come to the facility and inspect the computer testing center to be sure that it meets certain standards. And Texila met all of those standards. We are a secure testing center for NBME. But as I was saying, this Kaplan Review course, or the Integrated Basic Science Review course, prepares students to pass this examination that they take at the end of basic science, the comprehensive examination. If the students are unable to pass this examination, it is a predictor that they're unable to pass the licensing exam. They're not allowed to move forward. Also, during this time, we have a course called Introduction to Clinical Skills. This is a course which prepares students to enter the clinical rotations and goes into detail about issues that will make the transition a little bit easier for them. Also, it pulls together much of what they've learned in doctor-patient relations earlier semester. So once students have made it over those hurdles and passed the NBME comprehensive, they're ready to move on to do their core rotations. The core rotations are very classic medical clinical rotation curriculum. 76 weeks of clinical rotations. These rotations are done at the Guyana Public Hospital Corporation in Georgetown and at the Tucson Medical Center in Tucson, Arizona, in the United States. A little bit about the sites. Georgetown has 600 beds. It's the main teaching hospital for the country and is the tertiary referral center, not only for the region, but for the entire country. Our students can do all of their core rotations there, as well as virtually every major elective. Tucson Hospital is a relatively new addition. Tucson is located in Arizona in the United States, and Tucson Medical Center is a nonprofit, locally owned medical center that is affiliated with the University of Arizona. It's the largest hospital in southern Arizona. It has about 450 beds, and our students are able to do their rotations at this hospital because it is ACGME approved. In other words, it's approved as a teaching hospital by the U.S. Licensing body. This is very important for students who may want to transition and try to practice in the United States or go into the United States to a residency after graduation, because it's important in order to be allowed to move on to get licensed in the U.S. Students do all of their core clerkships at ACGME approved clerkship sites, and indeed Tucson Medical Center is one of those. And basically, the hospital in Georgetown has the equivalent type of approval and equivalence for our students who want to go on and practice elsewhere. Once our students are graduates, rather, can go on and practice about anywhere in the world. Now, the core clerkships that students go through at our clerkship sites include internal medicine and general surgery. These are the most important cores, and they're 12 weeks each. This is the core information that students need to understand clinical medicine. Pediatrics, psychiatry, OBGYN, and family medicine are all 6 weeks well. and they are also part of the cores. Each of these core clinical rotations, at the end of 12 weeks in internal medicine, for example, the final exam, it's not our internal exam, it's the National Board of Medical Examiners exam in general surgery, in pediatrics, in psychiatry, in all of them. It ensures that our students are receiving the same type of training that other universities around the world are providing for their students. Once students have cleared all of these core clerkships, then they're eligible to move on to the fourth year. This is the year that students do electives. And electives can be done both at Georgetown Hospital in Guyana or at Tucson Medical Center or other hospitals as long as they meet the proper criteria anywhere in the world. And the electives are designed to help students determine just what kind of field of medicine they would like to go into. And it helps exposes them to different pathways. But if they've already determined what type of medicine they would like to practice, then they can also focus on their electives on that particular field and help prepare them. We have very strong counseling for students, career counseling that occurs with their faculty mentors as they move through the clinical rotations, both for the cores and into the elective years. Elective year. We help advise them and determine just exactly which electives would be best for them and where. This is a list of major electives here, but there are many more in students as long as they are approved by our medical education department are allowed to do these electives. Also, electives can literally be on the job interviews and training interviews for students who want to do residencies at a particular time. They can do an elective perhaps at Medical Center or in Georgetown in radiology, if that's where they want to do their residency. But the fourth year is a very important year because it's a year that they begin to think about residencies, to start applying to residencies, especially if they're going into the U.S. Anywhere just about. And then also it's a year that they need to start thinking about their licensing exam. These licensing exams are vary widely from one country to another. But because our institution is accredited, our students are eligible to prepare for and sit for licensure exams at many countries around the world, any of them, because of this accreditation. These are just two examples. CAMC is very common for our students who want to stay in Guyana, our Guyanese students, and also students we have from other parts of the Caribbean, such as Jamaica, would take this examination. It's the exam used by the Caribbean Association of Medical Council. It would then make them eligible to be licensed anywhere in the Caribbean and CARICOM countries. Also, students would be eligible once they pass their comprehensive exams to take the United States. So at the end of their clinical rotations, students would take the comprehensive exam and be eligible for graduation. NBME comprehensive exam in clinical sciences, and then move on to. We have good information and data from other schools also that students who pass these NBME exams, who've taken them all along since day one in anatomy, they feel comfortable in that exam setting. They know the style of it. Exam that it is and the types of questions that are asked. So it makes them better at taking these exams as they move forward. And we have good information that if students pass these, especially the comprehensive exams, they will pass their licensing exam. As I would mention several times, career counseling is an important part of our curriculum. And it begins from the very first day. Students are able to get guidance and counseling from just about any faculty member, not only their assigned advisor, but virtually any faculty member's door is always open. That includes basic science faculty as well as clinical faculty. And students do take advantage of this and get good advice as they move through sciences and on into clinical sciences and on to residencies. The recommendation as they go on to apply to postgraduate training and other opportunities, and we provide all of that information for them and those letters. In the United States, for example, the MSRP is a letter that has to be written by the dean for all of those letters. We also have a very active alumni service, which reaches out to students and alumni and to provide services and to help disseminate information. So that's basically everything I have on Texila American University College of Medicine right now. Again, we're very happy about our recent accreditation moving forward, and we look forward to maintaining these high academic standards, which we will have to do in order to maintain our accreditation. We have every intention to do that going forward. So with that, I'll open it up for questions. Anyone?
I hope there is a question from the attendee.
Hello. My name is Alexis Williams.
Hello.
Hi. I have a question about the alumni services. Is it only available to fourth-year students, or you can access it straight from pre-med?
The alumni services are only for students who've graduated, the alumni of the school.
Okay, but is it also possible to contact the alumni from school if you need help apart from counselors?
Sure. Yeah. I mean, if an alumni has a question about anything, we also have student service, to whichever place that might need to answer their question. But yeah, absolutely. They can contact them. Usually through student services is the best way to go.
Okay. Thank you very much.
Yeah. Yes, the question is, in the transition semester, along with the Kaplan Review course, will the faculty on campus also be teaching students? Yes. Actually, we also have clinical faculty that come from Georgetown Hospital to help teach in that particular course. So the students are exposed to both clinical and basic science faculty. And by the way, by the time they've reached that point, just about all of their faculty have clinical experience. Tuition costs, you can find that on the website.
Might not qualify NEET, but MBBS from abroad.
The question about residency matching interviews, yes, Texila will help you with your prepare for your interview once you get one. That's for sure. Yes. The question about tuition costs can be handled with on the website again, and with student. All as far as the Hindi language, all curriculum is taught in English. Everything is taught in English. Matter of fact, that MMI, the mini mental interview, part of that process is evaluating students' ability to speak English. Another question, can we still match in the USA if we do rotation in Guyana? Yes, that is certainly possible.
There is a question from Shana K. Williams. Shana, I'm typing my mail ID and you can reach out to me for your tuition cost. And we do also provide scholarships, and both the tuition fees and scholarship details, you can reach out to me. I will help you out with that. Okay?
Is there an opportunity to specialize? Yes, absolutely. We have many graduates who specialize in different areas, including surgery, pediatrics, radiology, those types. Dentist is on this list. Dentistry is an entirely different specialty and an entirely different school. So we have a dental school, but all of these other things, yes. The Kaplan course is online. It's not live. It's a video course, but it's also proctored by our faculty. So there's interaction. Students can ask questions, and the question is, can you provide of what how many have cleared USMLE matched recently? We have had both occur. It's been very small numbers in the U.S. because we have so few graduates who are desiring to come to the U.S. in the last few years. Part of that's probably been because of the pandemic. Also, we've only fairly recently been accredited. So I anticipate that these numbers will increase. So it's hard to give you any specific answer on this right now because our numbers are so small. Alexis Williams has a question. As a student of Texila, am I eligible to write the Canadian medical licensing exam? As a graduate of Texila American University, yes, you would be eligible to sit for Canadian medical licensing exams. And that implies that you've, passed all of the other relevant examinations.
On behalf of the students, I am asking one question. And after completion of the degree, Doctor of Medicine program from Texila American University, and what is the duration for residency, and what is the process to get the admission, residency admission in the United States?
Well, the residency depends on what residency you want to do. I mean, general surgery is 5 years of residency, postgraduate training, whereas pediatrics is 4 years, or internal medicine is 3 years. So that varies a lot. As far as the process in the U.S., graduates have to go through what is called the match, and I didn't really go into a lot of detail on that, but we do help our students go through that process. And we've recently had 2 or 3 that have done it successfully. And the match program is done in the U.S. every March. That's when senior medical students apply to residency programs where they want to go. The ones that interview them and then want them to come, the programs would then rank the students. Students then rank the programs. That's called the match. Then it's electronically matched. But yes, we help students go through that process, and we have counseling for that. And like I was saying, our numbers have been pretty small, but it's a process that the dean at Texila is very familiar with, as well as myself, because of our experience.
The polls had been launched. Attendees are requested to attend the polls. So, any other questions from the attendee side?
There are some other questions also. Does the Texila University offer any free scholarships? Sorry, I have joined session late. Yes, definitely the tuition fee after the scholarship has to be paid by the student. And we do offer scholarships that is automatically will be awarded to the students if the student is able to provide all the required documents, if he is able to get the admission at Texila American University. And we do have 2 different programs. One is US Pathway that around the scholarships around $46,500. If the student studies entire 5-year program in Guyana, at that time, the student will get the scholarship of around $26,500. Students who have joined this webinar, if you have any questions about the program, scholarships, tuition fees, and security, safety, facilities, and regarding accreditations, approvals, anything related to the program, you can always reach out to me. I have typed my mail ID as well as a phone number here. You can reach out to me directly, and I'm happy to help you and all the queries. Thank you so much. Dr. Hugh, one more question. Can we take PLAB exam by our school? PLAB, UK.
What is PLAB? Oh, yes, absolutely. Yes, students will be eligible to sit for that, just like they would in Canada, anywhere else in Europe also. So
great. Okay. Harish, that helps your question. Okay.
Yep.
Thank you, Dr. Hugh.
Okay.
Sure.
So thank
Thank
you,
you.
attendees. Yeah, thank you for joining us for the today's session.